Good day everyone, my name is Charmaine Rivera Imbalsado from Group 2 and now we are going to present about anatomical movements. Anatomical movements can be defined as the act or instance of moving the body structures or as the change of position of one or more joints of the body. There are 9 pairs of anatomical movements that we are going to highlight, and I will be the one to discuss about flexion and extension and also abduction and adduction, and the rest of the movements will further discussed by the following members. Flexion and extension. Flexion and extension are movements that occur in the sagittal plane. They refer to increasing and decreasing the angle between two body parts. Flexion refers to a movement that decreases the angle between two body parts. Flexion at the elbow is decreasing the angle between the ulna and the humerus. When the knee flexes, the ankle moves closer to the buttock, and the angle between the femur and tibia gets smaller. While extension refers to a movement that increases the angle between two body parts. Extension at the elbow is increasing the angle between the ulna and the humerus. Extension of the knee strengthens the lower limb. Abduction and adduction are two terms that are used to describe movements towards or away from the midline of the body. Abduction. Abduction is a movement away from the midline, just as abducting someone is to take them away. For example, abduction of the shoulder raises the arms out of the side of the body. While adduction is the movement of the body part toward the body's midline. So, if a person has their arms straight out of the shoulder and brings them down to their sides, it is called adduction.
Good day everyone. Today I will be discussing about medial and lateral rotation. Medial rotation is the movement of a limb or muscle group toward the center of the body, and is also referred to as internal rotation. This type of rotation also ensures that repetitive stress of rotation on a body part or muscle group does not pose a significant injury risk. And this is one example of a picture that shows a medial rotation. Other examples include turning the legs at the hip so that the toes point toward one another and reaching the arm across the waist toward the opposite side of the body. Moving forward, lateral rotation is also referred to as external rotation. It is a rotation along the long axis of a joint, and this movement is away from the midline of the body and occurs in the transverse plane. This picture shows the difference between the medial and lateral rotation. Other examples are when the leg is laterally rotated, it is turned out at the hip, causing the toes to turn away from the body, and as well as to turn the arm so that the palm of the hand is facing forward. That's all for this presentation. Thanks for watching and stay safe.
Good evening everyone, I'm Chili Nunez. I will be reporting on elevation and depression. Depression and elevation are downward and upward movements of the scapula or mandible. The upward movement of the scapula and shoulder is elevation, while a downward movement is depression. These movements are used to shrug your shoulders. Elevation movement. Elevation is the upward movement of structures of the body. For example, elevation of a shoulder joint raises the corresponding arm vertically upwards rather than outwards to the side or any other direction. The movement of elevation is the opposite of the movement of depression. Depression movement. Examples of depression include returning the shoulders to resting anatomical position after shrugging, depressing the mandible during mastication or phonation to open the mouth.
Good evening everyone, I am Clinton Nunez. Let us talk about the pronation and supination. Pronation and supination are a pair of unique movements possible only in the forearms and hands. allowing the human body to flip the palm either face up or face down. The muscle bones and joints of the human forearm are specifically arranged to permit this unique and important rotation of the hands. Pronation is the motion that moves the forearm from the supinated anatomical position of the pronated palm backward position. This motion is produced by rotation of the radius at the proximal regio-ulnar joint, accompanied by movement of the radius at the distal regio-ulnar joint. Supination is the opposite motion, in which rotation of the radius returns the bones to their parallel position and moves the palm to the anterior facing supinated position.
Dorsiflexion and plantar flexion. Dorsiflexion. Dorsiflexion is the backward bending and contracting of your hand or foot. This is the extension of your foot at the ankle and your hand at the wrist. You can also dorsiflex your fingers and toes. The upward flexion of the foot is called dorsiflexion. Dorsiflexion reduces the angle between the leg and the dorsum of the foot. Dorsiflexion occurs in both the ankle and wrist joints. Plantar flexion. Plantar flexion is a foot movement in which the toes and foot flex toward the sole. Plantar flexion is the movement that allows you to press the gas pedal of your car. It also allows ballet dancers to stand on their toes. Plantar flexion refers to the movement of the foot in the downward motion away from the body.
What is anatomical or anatomical movement? Anatomical motions are defined as the act of occurrence of moving physical structures or changing the position of one or more of the body joints. The anatomical movement, which is the common starting point for describing movement, is used to describe joint motions. Sequential combination of flexion, adduction, extension, and abduction produces circumduction. Multi-axial plane joints provide for only small motions, but these can add together over several adjacent joints to produce body movements such as inversion and eversion of foot. Inversion and eversion. Eversion is the movement of the sole of the foot away from the median plane, while the inversion is the movement of the sole towards the median plane. Like for example, inversion describes the motion when ankle is twisted.
The opposition and the reposition are the special terms that describe the movements of the thumb with the other hand fingers. So, the opposition is the movement that will bring and approximate the thumb, which is the first digit of the hand, to another finger of the same hand, like when we bring the thumb and the little finger together. So, we will bring the tip of the thumb and make it come to meet, and oppose the tip of the little finger, and we have a magic way to memorize the movement. Imagine, when we oppose the thumb to other finger, we will create an O shape between them. So this created O shape will stand for the first letter O in opposition. So the opposition term, as we know, is the movement that bring the thumb to other fingers of the same hand. And this movement will be used frequently when we need to pinch someone, or when we need to button our shirt, or when we lift a teacup with its handle. So this is an example about this movement. While the reposition, on the other hand, is the exact opposite term for the opposition, and this term will describe the movement that will return the thumb or the first digit of the hand from the opposition position, the anatomical position, the hormal position of the thumb. So, in the previous example of the thumb and the little finger, the reposition will move the thumb and the little finger away from each other and bring the thumb back to its
I'm Chelsea Nicole Ilanan and my topic is protraction and retraction. Protraction and retraction. Protraction is required to perform full range of motion push-ups and to perform movements like gymnastic planche. In retraction, the scapulae move towards the spine and toward each other. Retracting is done by squeezing the shoulder blades together. Why it is important? During upper body pressing and pulling movements, the humerus constantly moves through different degrees of internal and external rotation. The muscles involved in this small but significant movement are the rotator cuff muscles. Any slight misalignment of rotation can cause shoulder pain and injury, so it is rather critical that these muscles work correctly. In addition, we can improve both scapular retraction and protraction by repeatedly practicing exercises that engage the muscles activated during these movements. This will improve shoulder stability, posture, and overall health of the shoulder joint. These are the example exercises: band scapular retractions, hanging scapular retractions, low rows, lateral pull-downs, reverse flies, push-ups, dynamic stretching, bilateral external rotation, standing rows.